Welcome to Mind My Age, presented by Total Life, therapy focused on healthier aging and covered by Medicare. I'm your host, Neelam Brar, and today we're addressing an important topic, men's sexual health, and how it can positively impact aging. Our guest is Dr. Elliot Justin, a leader in men's health, MD, specialist in emergency medicine, and a medical technologist with a specialty in remote patient management devices. Dr. Justin, it's a pleasure to have you.
Thank you. It's great to be here.
So I always start the Mind My Age podcast by asking our guests how old they feel and what's their secret to feeling young and healthy, because we really believe that, your mind has a profound impact on your physical health in the aging process.
Well, I'm 71 years old, and I try to make love with my wife every day. We hit that goal probably 5 out of 7 days, and we both regard that as the key to a very, very happy 36-year marriage. And I recommend that to everyone. And actually, there's science behind that as well too. So, for example, there's a large study out of the United Kingdom showing that men over the age of 70 who have heart disease, who have sex twice a week for 20 minutes, cut the risk of cardiovascular death by 50%. So that's an enormous advantage. We also know that men and women who have sex every day cut their cortisol levels by up to 50%. That's the stress hormone. And we know that couples that have sex twice a week versus couples that have sex twice a month have half the divorce rate. So the benefits of sex are enormous. And how do I stay young? That's part of it. I work out 3 times a week. I'm fortunate to live in Montana. I own horses. I try to ride 4 or 5 times a week too. There's something really magical to my mind about loping along.
That's amazing. There's obviously so much you just said there. So let's unpack that. You've done extensive research in men's sexual health. Can you explain how the sexual health ties into overall health? You mentioned cardiovascular disease, reducing cortisol levels. Like, what are some of the other top benefits of having a vibrant sexual activity?
Well, there's probably not a body system that doesn't benefit from regular sexual activity, from one's mental health, the satisfaction in one's in relationships, one's self-esteem, onto cardiovascular, and even skin and immune system, or decreased duration of flu. There are so many studies validating this, but yet we don't emphasize it. We doctors fail our patients about this. We doctors make recommendations about diet, exercise, sleep, alcohol, drugs, compliance with medications. We don't make any recommendations about sex, and we should. We don't even ask, and the patients don't ask either. So here you have this area that's of vital importance to people's happiness and overall health, and also reflects the side effects of medications, and we don't ask. So, for example, for men and women, doctors prescribe, there are 2 classes of medications that are commonly prescribed. More than half the country is taking one or both of them, and they are antihypertensives and antidepressants. And most of the antihypertensive medications and almost all the antidepressants have a negative impact on sexuality, both desire and ability to climax. Well, that's a major problem. So it's as if we doctors think, oh, this area of life was unimportant because we don't ask about it. And patients get that same sense from the doctors. Well, this is embarrassing. I'm not going to talk about it. He or she's not bringing it up, and I'm not going to respond. But with technology, one can actually assess the status of one's sexual health objectively. And then if one is taking medication, one can then titrate the dose. What dose is right for me? What dose is not good for me? So we need to recognize the importance of this. Neil, let me give you an example, a glaring example. You and I, we're different genders, different ages, different degrees of health. Let's suppose that we both notice that when we exercise, go to the gym, our pulse feels really, really strong, and it's irregular, and we feel lightheaded. And if we went off to our internist or general practitioner and said, "Gee, we got this problem," and the general practitioner said, "Hey, Neelam, there's a flight of steps outside my office. Go down the flight of steps a couple times and come back into the office." And then that doctor put his hand on your pulse and said, "Yeah, Neelam, your pulse is irregular, and it's really strong. I think you have high blood pressure and a cardiac arrhythmia. take these 2 pills and come back in 3 months, you would think, to be rude, WTF, it says 1900, you got a blood pressure cuff here in the office, you have an electrocardiogram, you have blood tests. But that's where we are when it comes to sex. We don't currently, we do now, but in general, we don't assess these things objectively. We say, hey, take this pill, come back in 3 months. And that's wrong. We don't treat blood pressure that way. We don't treat cardiac arrhythmias that way. Matter of fact, we don't hardly treat anything in the body that way. We try to make what we're doing as doctors, both on the diagnostic side and the management side, objective with data.
So, doctor, why is it that today, when you come in, even for your annual visit, the form that you have to fill out never asks about your sexual activity if it's such an important, right?
It's really shocking. Why is it? Well, I think we could say part of it's cultural, and that's worldwide. There's just an inhibition about this, but big part of it is money, and it's wrong. So, in the United States, the 2 biggest electronic healthcare records, which drives healthcare, in the United States and in most healthcare systems, you get the care that can be billed for, not the care that you necessarily want. The most glaring example of that being, what do most people want from a doctor? Advice. What do managed care, Medicare pay for advice? 0. So I call them the don't cares. So if you go into Epic or Allscripts, the 2 biggest records in the United States, there's no questions about sex. If you and I went to a doctor and said I had chest pain, they get 15 questions that they're supposed to ask. And if they don't ask those questions, the computer says essentially, hey, stupid Elliot, you didn't ask these questions, and you need to rule out all these other conditions. Could be a heart attack, could be dissecting aneurysm, could be a pulmonary embolus, could be an ulcer. But when it comes to sex, there are no questions to ask. So I tried this out. I went to my local urologist here in Montana and said, gee, pretend I'm a patient here. I come in and I say I have erectile dysfunction. And bear in mind, for your 50% of men by age 50 have erectile dysfunction. 55% of women, it's called female sexual dysphoria, but it's erectile dysfunction in women as well too, by age 50. By age 70 for men, it's 70%. I'm 71 years old, and there are no questions. There's no requirement they ask anything. And if you tell them you have ED, they'll just say, take a pill. They don't really ask what's going on. And the most critical question to ask, I've learned from speaking to our customers and our research is, can a man attain erection? Or is the man's problem that he can't sustain erection? And that's really, so if a man can't attain an erection, that man has a significant cardiovascular medication side effect until proven otherwise. And that man needs to see a urologist and or a cardiologist. If a man's problem is he can't sustain an erection, it could be anything from performance anxiety, even in older men. We tend to think of performance anxiety being something that affects young men, affects older men as well too, and women, or it could be a medication side effect, or it could be drugs, alcohol, or other problems. But doctors don't ask these questions because there's no prompt in the machine that tells them to do that. There's no money for them to make. There's no box to check. It's sad.
So, for those of our audience members that are listening and don't know where to start, but are facing some of the symptoms you just mentioned, what should they do?
I was unaware until I got into this sector 3 years ago, that the number of nocturnal erections that a man has while he's sleeping is a leading indicator of a man's cardiovascular health. And the same thing probably pertains to women as well too. It's just less obvious. So we all joke about morning wood, and does a man have morning wood? But one erection is not enough. A healthy man, even a healthy man my age, 71 years old, should have 3 to 4 nocturnal erections per night. And they should be of a certain hardness of a certain duration. And until now, that technology didn't exist, but now it does with the tech ring that I invented along with a urologist. So what should a person do? People need data. I don't want. I'm not here to promote my product. I'm here to promote education. People need to who has erectile dysfunction needs to have a frank conversation with their internist, and ideally probably the urologist. Because the internists and general practitioners are not oriented towards looking at this overall problem. Because what their internist or GP will do is just say, just give them a pill, and a pill could be masking a problem. So when we talked about leading indicator in medicine, I want to go back to that. Leading indicator means it's predictive. In medicine, we treat associations. Now, in the Medicare population, more than half of them have hypertension and or diabetes, and often both. And they have ED. And if they haven't decline nocturnal erections, they, but by being a leading indicator, I mean you will have a stroke or a heart attack. So a man whose nocturnal erections go from 5 to 2 or 3 to 0, that man has a 50% chance of having a heart attack in the next 2 or 3 years. Now that's profound. That's why I got into this space. Whereas a man who just has high blood pressure, well, high blood pressure is associated with heart attack or stroke. It's not predictive. Men can have high blood pressure for a long, 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 long time before they get a heart attack or a stroke. So it's important that men with erectile dysfunction, especially older men, I mean, older age of 45, 50, that they recognize that this is an indication, could be an indication of cardiovascular risk, and they need to get it assessed. So they need to be prepared, if necessary, to initiate that conversation with their internist or their general practitioner, as well as urologist, and not just accept, hey, take this pill, because the pill could be a massive problem.
Well, and coming back to, there are a lot of medicines that create the problem or exacerbate it. Like, so what are some of those medicines that people should be looking at that might be impacting their ED symptoms?
Almost all the SSRI antidepressants can have an impact, and that's we have men using our technology to assess what's the right dose, because what the doctors do is we treat everyone as if they're one size fits all. If you and I, again, with different ages, different weights, different genders, if we went to our family doctor and said we're depressed, they're going to probably put us on the same dose of whatever, Wellbutrin or Lexapro, whatever, Cymbalta, whatever it is, and that's kind of stupid because we actually, the medication should be ideally be related to some objective monitor. So we don't, with blood pressure, we check someone's blood pressure and we give the dose is based upon the blood pressure. But when it comes to depression, that's not the case. Now, when it comes to a lot of the antihypertensives also have an impact on sexual function. I'll talk about myself. Probably because I'm involved in a startup, and I'm old. I started getting high blood pressure last October. My internist recommended I start lisinopril, common antihypertensive, and lisinopril made my erections 15% less hard. Why would I take that drug? I switched to losartan, and the problem went, the problem went away. The beta blockers are antihypertensives. They're low pressure, probably being one of the big ones. And these are we call them cock killers. They are killers of erections. And doctors need to warn people about the sexual side effects of medications, and they never do. I bet you've never had a doctor warn you about the sexual side effect of medication. I've never had a doctor warn me about the sexual side effect of medication. My wife has never had a gynecologist warn her about the sexual side effect of medication, and it's a failure on the part of physicians, and patients need to. Hey, you're alone in this. If men have erectile dysfunction, or women, you need to manage your own care in this area, because there's so much ignorance.
Well, it's, and you're absolutely right. It's very common for this aspect to just completely get overlooked in the entire healthcare screening process. And if the drugs are actually making it worse, they're kind of counterproductive, right? Because as you said in the beginning, sexual activity, healthy sexual activity can improve your dopamine levels. It can improve your health. It can improve your sense of self-worth and confidence, all things that could actually support you navigating a happier and healthier version of you when you're depressed.
Well, one thing I've become aware of, Neelam, through speak, because I make a chunk of my time available to our customers, because I want to learn about what people are doing, how people are utilizing the technology, what problems are people experiencing. I am amazed and pleased by the number of people in their 70s or 80s who are making love regularly, and often aided by technology, because they're able to figure out, well, I'm taking 5 pills that could be affecting my sexual performance. What if I eliminate this one or decrease this dose? I wish that people, we tell people to, of course, to discuss, don't change your medications without talking about your doctor. But I think the degree of distrust is such that I suspect that many people aren't. And then as far as the interventions go, with the PD5 medications, which are Viagra and Cialis, they're the most popular ones. Well, they put more blood into the penis, But if a man already can get an erection, that man's problem is not getting blood in the penis. As we get older, it's keeping it there. Every man develops, I call it venous leak of aging, doesn't have an official name, but we all, as we get older, even in good physical condition, the smooth muscles that constrict the small veins and hold and keep blood in the penis specifically, or the clitoris for that matter, they weaken with age, and the small veins become stiffer. An analogy would be to if I got on a plane, and maybe even someone your age, got on a plane 5 or 6 hours, my socks were a little bit tight afterwards. My rings were a little bit tight. Why? Because when I was 25 years old, it didn't happen. Why does it happen to me at age 71? Because the smooth muscles around the veins in my legs, or my fingers, they are weaker. They're not pumping blood back to my heart the way they did in the past. So I get some swelling. Now in the penis, what that means is the blood leaves the penis because the veins are weak. So if a man can get an erection but can't sustain it, the solution is a mechanical one. And this is when we have research, several papers about this that have been either accepted publication or going to be presented soon. Because I became interested in what's better for men, a pill or a ring. And it turned out that the ring, a good ring, comfortable erection ring, they can commonly call cock rings. The doctors call them penile constriction bands. I don't know what Nazi thought a constriction band. What guy who's worried about sexual performance wants to put a constriction band on his penis? And I call them erection rings. So an effective ring will hold the blood in the penis. That helps the man. That helps the man to stay in erection. It also leads to more pleasure because the more blood's in the penis, the more sensitive the head of the penis becomes. It's also more satisfying for the partner. So because as people get older, young people often have performance anxiety because they're with someone new and, alcohol, drugs. Old people get performance anxiety because as they get older, men, I'm not going to talk about specifically, women have women's issues we can talk about in a moment. As men get older, their blood leaves the penis faster. And heck, when I was 13 years old, I could hold a girl's hand and have an erection for an hour and a half. That doesn't happen anymore because I might get aroused, but I'm going to lose it faster because of age, largely. Other psychological issues, but because of age. And the ring keeps the blood in. So I'll just talk about my own personal experience. I never used, I don't have ED technically. I can make love every day. But I never used an erection ring before. But I use our ring all the time. Why? Because it's a confidence builder for me and for my wife. Because if we want to talk about the Medicare population, one of the things that people don't want to discuss is boredom or having babies. So there are and both boredom or lack of friction because a woman has had many children, then the internal bones are further apart. These are problems that people. It's funny that people, they're so common, and I never really thought about them until I was again talking to my customers. They're so common and so easily addressed. So I'll give you a personal example. When I came up with the ring about a year and a half, it'd be like a year and a half ago, February, a year and 2/3 ago. My wife and I were making love. We live in Montana. It's February, and my wife says, "Oh, because by the way, I'm about to reveal something that men complain about a lot about women that women don't know that men complain about, which is that somehow or other many women in the middle of even when they're really aroused can just start talking about something else, like a fight they had with the kids, or something happened with their mother, or heck, so anyway, we're making love. My wife says, "Oh, I left the garage door open and snowing." Well, in the real world, of course, it's not the woman's going to jump out of bed to close the garage door. It's going to be the man that's got to do this. So I went downstairs, closed the garage door. Not the garage door open, but her car was open too. She must have been unloading packages. Ordinarily, for in our relationship, and I think in many relationships, this would have been let's just call it WTF moment. Like, hey, you can't hold on to that thought for 5 more minutes. You got to start telling me about something else while making love. I'm coming up the stairs, and my wife says, "Well, you know that tequila I really like? Will you put some on ice with a twist of lime?" Well, I'm a guy, been married a long time. That would have led to another explosion on my part. We're not making love tonight. I'm done. This is done. Instead, I come upstairs, I have the ring on, and I'm still erect. And a man with an erection thinks differently than a man who's lost his erection. And my wife laughed and said, the garage door was really open, but the tequila was a test. So the point being that the rings are confidence builders for both people. They will keep men hard when people are distracted, when other things occur. And so one of our goals is for older men to understand that rings should be mainstreamed. They're not, you shouldn't regard it as an aid. You should regard it as an enhancer to your pleasure, the way women regard vibrators today.
What are some of the most often objections that you're hearing from men regarding wearing a ring versus taking a pill?
Sure. Well, there's a pride issue with men, uh, and it's largely an issue for straight men. So, 90% of gay men use erection rings regularly, and only 10% of straight men do. And one of the jokes we have at medical meetings, like the American Urology Association, is how do you tell the difference between a gay doctor and a straight doctor with one question? Do you use a cock ring? Gay doctor, last night, you got a better one? Straight doctor, oh, it's like Superman kryptonite. Oh, I don't need that. I don't need that. Well, it's not about need. It's about want. Do you want to last longer and have more intense pleasure and more confidence, and have your partner also enjoy the benefits of your lasting longer and have more confidence? So the objections, I think it's really pride. It's the I don't need, as opposed to recognizing that I should want this. There's also really it's a very, very small number of men say it's uncomfortable. I mean, we've sold about 13,000, and maybe 20, 25 men say they're uncomfortable. So I think it's an issue. It's a psychological issue for men. Look how long it took vibrators to be mainstream for women. I mean, my mother's vibrator was in the bottom dresser drawer of supply closet. That was the 50s. In the 70s and 80s, when I was dating and they're becoming popular, there was still this notion, oh, you, Neelam, you should need to come with penetrative sex, shouldn't need a vibrator. And now they're mainstream. I don't know how many wife owns. And our daughter, who's 29, takes them on dates. So it's no longer seen as a crutch for women. It's seen as it's seen as normal. And any guy who's not too proud recognize that, hey, I don't care if my partner uses a vibrator. It's enhancing her pleasure. It's great. So I think men need to see erection rings in the same context. And I think some of this will come from women. Women need to educate men. Women, what we're really doing here at Femtech is not really a sex toy, because there's non-data component, which is the ring, which will help sustain erection, and then there's a data. Women pay more attention to their health than men do. Men are deniers. We have women buying our device for their men to demonstrate to the man that you have a health problem. We've had 2 men get cardiac catheterizations that I'm aware of, because their wives finally, said, hey, let's figure out what the problem is. Stop blaming me for this or attributing it to age. Let's find out objectively. Is it your heart? Is it or is it psychological? So that's I think that women, as more and more data and research gets out there, women will start to pick up on this, and I think that women will change men's behavior.
So when we think about like the alternatives people have as they age, the pill has obviously had a lot of marketing and normalization in society.
Yeah, and it's if you go back to the original research in the 90s, there are several papers showing the pill is no more effective than placebo. Now, the placebo effect is really powerful. So the range of there are a lot of studies. The ones that the pharma puts out are all the positive ones. You're not going to see front page news about the ones that shows more effective than placebo. The range from 0% to 70% for efficacy. And I think, and there was a meta-analysis where someone pooled all this data, and they said, okay, the pill is decided that Viagra, specifically sildenafil, now it's generic, is 20% more effective than placebo. Well, that's not all that effective. But but you can't turn on the radio without hearing ads for PD5 medications. And our research shows that that pill a ring is twice as effective as a pill under this circumstance. So we looked at the first people to have a look at detumescence in research. So detumescence is the time it takes for erection to go down after climax, and we want to compare the pill versus specifically 10 milligrams of tadalafil, which is Cialis, more commonly prescribed PD-5 medication in the United States, with our maximum performance ring. So the average erection with nothing went down 35 seconds. With tadalafil, it went down a little bit over 2 minutes. With the ring, it went down 4 minutes. And with both together, it went down in over 5 minutes. And there's independent research being done right now that validates this. So what the takeaway for men is, and our goal is to get urologists to embrace this, is the first thing that men should try is a ring. Rings have no side effects. They have no pill. With pills have side effects. The second thing, and then if you really want to talk crudely, rock harder, last longer, then take the pill and take the ring and the pill, because that's over 5 minutes. So that's a change in the way in which men are going to approach, and urologists are going to approach erectile dysfunction.
What about pre-climax, like effectiveness and time span to get to that point?
Well, the great, the pills and the rings don't work without human contact. I mean, there is this notion out there, especially the part of young women, that men have this wonderful pill they take and they get an erection. Well, Neelam, you're an attractive lady. If I pop 10 milligrams of Cialis right now, I'm not getting aroused. That's just not the way it works. Both the ring and the pill require either someone to masturbate or someone to be in a relationship in order to get aroused. And people, especially as they get older, need to recognize that it could take longer, especially if they're with someone new or they've been drinking, which is common as well too. And that's where the ring is valuable, because as blood goes into the penis, it stays there. I'm not saying men should not take the pill. I think overall, frankly, the pills are benign. And the only dangers with the pills are when people have that mindset of, hey, if the doctor says take 10, I'll take 30. But as long as people stay within limits, it's fine. But in terms of before climax, it's about foreplay, and also people recognizing that things that worked for them when they were very young aren't going to work for them when they're older. So one thing that's been interesting speaking to people is realizing, and the focus of urologists, and they have these objective scoring systems, is on penetrative sex, but that's not people in committed relationships over the age of 45, 50. Intercourse is often, I call it intra-play, if you will. It's in the middle. People are climaxing with oral and manual stimulation in general, with intercourse being secondary.
So a heightened sexual activity can be actually a great line of defense against disease and help improve your aging. What are some of the top 5 or more shocking things that you've uncovered in your research around sexual activity and health?
Well, let me focus on the intervention side. So there's some very expensive therapies that men are using for erectile dysfunction and aging men, and now they can be studied objectively. So I'll look at shockwave therapy, for example, which costs between $4,000 to $12,000, depending upon where one is, but it's expensive. It's not covered by insurance. Shockwave therapy will work for men who have mild to moderate vasculogenic erectile dysfunction due to hypertension, diabetes, or atherosclerosis. It will not work for people who have severe disease or who have no disease. So we have men who are utilizing now men can utilize technology, our ring specifically, to say, do I have nocturnal erections? Because if a man doesn't have nocturnal erections, that man has significant disease and needs a workup by a urologist or a cardiologist. And shockwave therapy is not going to help that person. And at the other extreme, if a man has 4 or 5 nocturnal erections, there's no point spending the money, because his erectile dysfunction is not due to vasculogenic disease; it's due to some other issue. And that can be really valuable for men to realize that, wait, my problem is in my head. So that's shockwave therapy. Then there's testosterone replacement therapy, very popular as well too, and it is covered by Medicare. So a lot of men think that if they go on TRT, that their sexual they will rejuvenate, so to speak, and but what we've seen with doctors who are using our device for research purposes with TRT is that um, the response is inconsistent. So you take the same man with I'll make it up, with testosterone level of 300, and another man with testosterone level of 300, and you put him on TRT, and one man responds with more nocturnal erections, and nocturnal erections that are harder and last longer, and another man has no effect whatsoever. So people can use technology to see where they are and how they're responding. And the reason why some men don't respond, I think, is because they're genetically they don't have the receptors that can take can deal with the increased dose of testosterone. So that's testosterone therapy. Then there's the P shot, the plasma shot, also expensive. Um, we haven't we have men utilizing it before to establish a baseline, and then following the data after they get the shot. And so far, the anecdotal reports to us show no benefit whatsoever. There's a company that's going to be studying Botox for erectile dysfunction, utilizing our technology. So right now, men take Botox thinking that it will make their penis longer, which it will. Not huge, but it'll make it. Men will gain half an inch, 3/4 inches, maybe even an inch in length. But the question is, it does increase the blood flow, and other men harder. And we don't know. There claims are being made that it does, but with technology, that can be made objective. Men can also use technology to assess what's the right dose of a PD-5 medication. Is it 5 milligrams, 10 milligrams, 20 milligrams of Cialis? Those are those are some of the therapies come to mind. Was there something other therapy, Neelam, you had in mind?
Also, you've just discussed the interventions, but what can men be doing to actually reduce the likelihood of even needing these interventions? Like, what are some healthier living tips that people could be incorporating into their day to day so that they're not the statistic?
People need to be cardiovascular fit. So a sedentary lifestyle, obesity are not compatible long term with a good sex life, and those things require significant amount of discipline for people to change. But it really behooves people to do it. It's also important that if they are diabetic, that they be relatively tightly controlled. And I put this out there because it's really important people understand. We have men utilizing our technology along with monitoring their blood sugar to show that if they get their diabetes under control, the number of nocturnal erections will increase. Meaning that their penis is getting healthier, basically, and their heart is getting healthier as well too, because the nocturnal erections are a reflection of one's overall cardiovascular health. It's about blood flow. So, not being sedentary, not being obese, complying with your medication regimens for diabetes. If you are taking an antihypertensive medication, discuss with your doctor taking one that is less likely to have an impact on your sexual health.
So the tool that you have, it tracks the nocturnal erections. Is that correct?
Yeah, it can be worn overnight to track nocturnals, and worn during sex to measure the hardness and duration of the penis during sex.
Okay. In addition to supporting the erectile.
Exactly. In addition to being an erection, exactly.
So that's really interesting. Now, if like a listener is thinking about buying this as a gift, it's not just for sexual activity; it's actually for health.
It's for your heart health. Yes. The urologists call the penis the canary in the coal mine of cardiovascular disease.
I like that. Tell me more.
Well, because it's a leading indicator. But I'm confident, Neil, and what we're doing is going to be copied. There'll be other devices. That's just the way there's so many companies making blood pressure cuffs. But men by the age of 45, 50 in the future will want to establish their baseline. Where am I? Just the way I want to know my blood pressure, I want to know my lipoproteins, I want to know my weight. They will want to know their nocturnal erections as baseline. And they can follow it over time. And if it starts to deteriorate, they can think, well, why is this happening? What can I do about it? So it becomes a preventive care measure. So we live, one of the things about sex, about wearables in general for health, is that people develop a positive relationship with them. People have Whoop or Aura or Apple Watch or Fitbit or even a digital scale. They will pay more, in general, they pay more attention to their sleep, their weight, their exercise. Well, I know it. People who get a sex wearable such as ours, it's not just pleasure, but it's also for health. They develop positive relationship with it, and they will make love more and pay more attention to the health parameters that affect their sexual health.
Well, yeah, I mean, they say you can't fix what you're not tracking, right? So this enables you to focus on the actual opportunity to improve it.
It's hack it to track it. You can't really start to hack it unless you can track it. Otherwise, it's just speculation. And there's so many when it comes to sexual dysfunction in men and women. Oh, by the way, I don't want to, we're all on the. Let's talk about sexual fitness. Let's be positive about this. Let's. We're all on the road. Even some as young as you. We're all on the road. I'm probably on the road from fitness to dysfunction. We all would like to know where am I on this road, and we don't know without data. We don't know where we are. We're lost. We don't have GPS. We don't have a dashboard. With data, we can say, here I am. I like where I am. I want to stop. I don't want to go on this road anymore. Or it could be, whoa, I got to make a U-turn because things are not looking good. What in my life, diet, exercise, smoking, alcohol, hypertension, diabetes, obesity, what in my life can I start to reverse? Because I want to enjoy, as does everyone, I want to enjoy a long lifetime of lovemaking.
If we think about, you had mentioned in the beginning the aging process impacts disproportionate number of men once they turn 70 around erectile dysfunction. You must have the data by now of how many nocturnal erections someone should be getting at specific ages throughout their aging process. Is there something that our readers can go look at in terms of the research or the studies you've done?
The old research was done with a device called the Rigiscan in the 1990s, and it looks like something Dr. Frankenstein would put in your penis and your ball and your testicles. Lots of wires going to machines, and you have to lie like this. People have to go to a sleep lab or stay overnight in order to get that data. And that data indicated was sort of general. Men should have 3 to 5 nocturnal erections per night. We have now documented close to 45,000 erections. We have the largest data set of erections ever. Now, because of cybersecurity, people are very private about these issues. We don't ask a lot of demographic information, but we do ask people's age, and we will be publishing that data on our website in about 2 weeks, and then that data is going to be reported at actually by me. The World Society for Sexual Medicine conference is in Rio in a couple of weeks, and I'll be reporting that age data, and the graphs will be posted on the website. I'm not supposed to discuss it until I present it, but I'll share it with you anyway. Men in the 25 to 35 age group are averaging 5 nocturnal erections per night, and we have 1/10 scale for hardness, and they're averaging 7 in the hardness. And I forget the number duration, but it's really significant. It's like 2.5, 3 hours of erections at night. At the other extreme, men in the 65 to 80 category, which is our oldest category, are averaging a little bit under 3 per night. This is pooled data because we have unhealthy men in that data set. I average 3.1, 3.2, and the amount of time spent erect at night is in men my age is under 100 minutes. So, because the erections are also indicative of our quality of sleep. So the sleep scientists think that every episode of REM sleep, quality sleep, so to speak, is accompanied by an erection. And there's going to be more research done on that in the future, because right now people are measuring the quality of sleep with a ring or a wristband. Well, that's not really telling. And those things are measuring your pulse and maybe
Sometimes your
your
temperature too, right?
temperature. But those correlate less well with REM sleep than with erections. Well, we are working on a device for women. So we've tested we tested a device on 38 women, and demonstrating that we could measure clitoral arousal. The device wasn't worn overnight. It was just worn. The women were masturbating under controlled circumstances, and they were controlled, meaning they were at home, but they could pick their pornography or pick whatever they want to fantasize about. And so we were able to change the pulse, change the heart rate, and since the women were awake, they were also able to document, yes, when I had these changes, I was having a clitoral erection. Our goal, we're working right now on different sensors for women that will allow us to actually measure the engorgement of the clitoris when aroused, the change in heart rate, change in temperature, even what position the women are in. And we've developed a form that we have shown that's been worn by 6 women overnight. And so now we need to marry the sensors with a form, and it'll take a year. I hope to bring the device out for women certainly by this time next year. But women have this. I'm confident that it's going to be the same thing for women as for men. That women's episodes of nocturnal arousal, nocturnal erections, whatever we want to call them, are going to be a leading indicator of their cardiovascular health or the impact of medications. And this device will be more valuable to women than for men because postmenopausal women have all the same problems that men do with heart disease. But premenopausal women take hormones and antidepressants. With hormones, men don't take they take hormones and antidepressants that have a significant impact upon their sexual health. And women now in the future, now I'm looking at a year, 2 years from now, women will be able to say, this birth control is impacting the health of my clitoris. Why am I taking it? If it's the wrong dose or change. Well, women will be able to say, why am I taking this antidepressant at all when I'm depressed? And this is actually impacting my sexual health. So that's going to be a really big change in the future.
Well, that's what I find really exciting about the work you're doing. You're essentially empowering the consumer to understand their sexual health in a more meaningful way. And also, you're connecting the dots on how it impacts your overall health and well-being, both physically and mentally.
Exactly. And it's filling a profound gap in both personal knowledge and physician knowledge about someone's overall health.
So if we kind of recap some of the tips that we've learned today in speaking with you and hearing your expert insights, in a week, having sex several times a week is critical. What are some of the other tips you have for the listeners here to improve their sexual health while they're also considering a device such as yours?
Sure. Well, the most important thing is communication with your partner, and to get over the embarrassment. Because what happens when people stop communicating, and then it gets just to be really awkward. People as they get older are quite capable of enjoying very active, satisfying, bonding, sexual, romantic, sexual relationships. People need to, but all people need to plan for it in order to get back into the habit of it, if you will, or get back into the practice. Once people fall out of it, I call it planning for pleasure. If you have an injury or you want to stay in shape and you go to the gym, you don't just show up and say, I guess I'll try that machine. I'll try that machine. No, people have plans, they have programs, and I'm not saying people need to have a whiteboard in their bedroom, but people need to communicate and plan together to maximize the happiness. I think it's important though that men, especially men with hypertension or diabetes, or men who feel that men have FED, they get their data, make it objective, figure out what's going on, get a data that is objective, actionable, and personal for you, and discuss that with your partners and with healthcare providers. I think men should also strongly consider putting a ring on it, whether they have ED or don't have ED, because they will last longer, be more confident, have more intense orgasms, and the partner's going to be happier too.
That's really fantastic to hear. And I think there's so much that people can take away. But one thing I'm definitely taking away from this is sex is good for your health and your ability to age healthier.
Again, I'll just reiterate some of the data. You can cut your cortisol stress hormone levels significantly by having regular sex. Your relationship will be stronger if you have sex. And there are studies showing that at least on the male side, I'm going to be showing the female side as well too, that if you have sex, you can actually decrease your cardiovascular risk significantly. So it's time for doctors to start recommending sex as well as other things.
We know that Surgeon General's warning last year was around loneliness and isolation for the older adult population, and getting out there and building relationships and having a healthy social strategy, right, is critical. And having strong relationships and bonds, both friendship bonds and romantic bonds, is essential. And it's so great to hear you bring your scientific background to such an important topic.
Yeah, let me just talk about, like, if you will, two extremes. We've had two men who had declined nocturnal erections get a cardiac catheterization. I'm not going to say that that saved their lives, but it saved them from getting a heart attack. They were able to get care before things were really bad. And on the confidence side, for older men who are divorced or widowed, we've had men who were afraid to date because they were concerned they wouldn't be able to perform. And then they see they have nocturnal erections, and it's such a relief to them. It's like, oh, it's in my head, and I tell these men, and women are not going to burn you. If you tell someone I haven't gone out with anyone for 10 years, they're gonna understand. And that's the type of person you want to be involved with anyway. Someone's going to work with you because they probably bitches as well too. So communication is really important, but getting the data can be such a profound confidence builder.
Well, and in addition to that, we believe at Total Life that there is a profound impact therapy can have on helping you kind of navigate the challenges that come with aging and changes in your body. It sounds to me like if somebody's listening out there and they're kind of thinking about getting back into the world of dating and relationships, um, the work you've done, the device you have discussed today, along with a healthy dose of therapy, could really help be the perfect combination instead of another pill or medicine.
Yeah, and also the device helps the therapist as well too, because with data, the therapist has a better sense about what the problem is. And we had two divorces that I'm aware of result from the device. Uh, one uh, one was, the guy was angry at his wife. They married a long time. Angry at his wife because you just don't turn me on. You're fat, blah blah, etc. Belittling, horrible belittling statements. Uh, and she took his phone and saw that he was having sex, but with someone else. Now that was that was profoundly valuable information, for her in a therapy situation. So and we had another situation where a man was also very belittling to his wife, uh, but he had no nocturnal erections, and the issue was him, not her. But in a therapy situation, that would be hard to discover, whereas the data made it clear what the problem was.
Yeah, absolutely. There could be so many misunderstandings when it comes to that chemistry, and a lot of people are shy to talk about maybe their physical limitations. And they don't have the data either, right? So you can add a lot more transparency to why people are feeling a certain way or behaving a certain way. When it comes to ED, what are some of the biggest misconceptions that men have, and what's your advice on managing it?
Probably the biggest misconception today is that the first thing to do is take a pill, and the second thing is if the pill doesn't work, it's probably hopeless. And I don't. I think it's one thing for a guy who's 30 years old to go online and get a pill, but for a man who's over the age of 45, 50 to go online and get a pill when there's a risk of cardiovascular disease or another physical problem, that's a mistake. That man needs a workup. And the other is that there's a lot more that can be done both on the therapy side and the medication intervention side than just taking a pill. And I don't think that uh, the other answer to ED is to go online and look for someone. I think that people need to spend better time. This is where therapy is important. Communicating with their partners about what they feel is going on between the two of them that's leading to problems, rather than just, hey, I'm gonna take a pill and let's see what's going on Grindr, or let's see what's going on Bumble. And uh, people are often are often, from my perspective, often prematurely destroying their relationships without really assessing both on the physical side and on the psychological side what's going on.
So, what's next in the field of men's sexual health? Are there new therapies or tools on the horizon that you're super excited about, or new research findings that you can't wait to share?
Well, on our side, we're making our sensors much more sensitive and specific over the next year. So that they'll be much more determinate of what the problem is. On the I think that we're going to have a better sense of who benefits from shockwave therapy, who doesn't benefit from shockwave therapy. Uh, don't On the female side, there's just the glaring need for data. And the device we developed, which we call Critique, will address that. Women will be able to establish as a baseline what is going on, so they can then measure the impact of various interventions. I don't see anything really other than that really dramatic coming on. I'm looking ahead 5, 6 years in the future. There's going to be a miniaturization of ultrasound, so that we actually will be able to, using ultrasound sensors, microsensors, we'll be able to look at the microvasculature in the clitoris and the penis and be able to say, oh, are the calcifications here? How bad are the calcifications? And will it be therapy to remove those calcifications? I don't know. Some probably shockwave therapy early on will probably be the answer for that. For most of my medical career, there's been this controversy about hormone replacement therapy for postmenopausal women. And at last, even though I think the evidence was there 20, 25 years ago, at last the medical community is saying, okay, hormone replacement, either both oral and or with creams, is the way to go. But they're leaving out testosterone. And I believe that testosterone replacement therapy for women will become the standard of care within 2 or 3 years. That right now there are creams. The problem with the creams is they're kind of, in my wife's phrase, icky, and the absorption is irregular because it's through the skin. It's not an injection. Now, whether pills or creams will work in the future, I don't know. But my experience and the experience of the very progressive urogynecologists with whom we work on our advisory board, our advisory board is half female. They uniformly feel that testosterone replacement therapy is the way to go for women. That testosterone, I'll just discuss my wife. She doesn't mind me talking about this. I started her on testosterone. She started on testosterone replacement therapy probably back October, November. Injections. She tried the creams, didn't like them, didn't comply with them because just didn't like the way they felt. And she feels they restored her to the sexual desire of a 35 or 40-year-old. Well, that has a profound impact on our marriage, because we've always had a good sex life, but after menopause, it became, yeah, I can climax, but I got to get turned on first, as opposed to wanting it, which is a more premenopausal, mental state, wanting it, and that's been great. And she says she's glad the kids are out of the house, because between my using the ring and her having testosterone replacement therapy, we're noisy and the kids are gone. So I think the TRT will be normal for women. I think that postmenopausal women who are experiencing decreased desire, they need to discuss this with their doctors.
Dr. Elliot Justin, thank you so much for sharing such invaluable insights on men's sexual health and how it plays a critical role in healthier aging. Your candidness about sharing your personal stories, as well as your open and honest approach towards sexual health, is refreshing. And I think we need more folks like you really discussing how important it is for people to be talking about sex and to be having sex. So, for our listeners, if you're facing any of the challenges discussed today, please reach out to Total Life. Expert therapists are available to support you, and the services are covered by Medicare. Don't forget to hit subscribe for more episodes that dive into the science of healthier aging. And stay tuned for more wisdom and inspiration at Mind My Age.